Peace, peace. It's your girl Morgan Renee Myers, up for a late night, early morning reading of the Health Hood Handbook. I read this probably about a month or so ago, late night. And I went to sleep early and woke up to go use the bathroom, and my body was just up. So here we are, and I've been wanting to read live. So I'm on Facebook. I'll download this and add it to my YouTube. Speaking of live, we got that live alkaline water, locally sourced here in Yadkinville, North Carolina. Black-owned water from black-owned land. Might as well buy from the black man and woman. We distribute this amongst NC. We also ship out of state, and we also have a hub in Atlanta and DC. Naturally alkaline is anywhere between 7.2 and 8.5. Very good water. We have them in gallons, 20-ounce glass, and we also do subscription for 5 gallons. But enough of that. Well, not enough of that. Can never get enough of water. But the Hood Health Handbook. I'm on a journey to continue aligning my diet and lifestyle. And so I just felt like reading this. And so here we go. So the first part of the book, I read the intro by Dick Gregory, the foreword by Dick Gregory, and like the intro. And so now I'm getting into the meat of the book. And it goes, are you healthy? Got to start somewhere. And then it gives you a pop quiz. Are you healthy? Before we jump into the content of this book, we got to be clear that this process won't work if you're not being honest with yourself in terms of where you're at and where you need to be. But even the most honest of people don't necessarily know how healthy or unhealthy they are, because there's so much to that whole health thing. So we're going to help you learn about yourself. Try the following quiz and see how you score. What have you got to lose? It's not like somebody's going to see your score and laugh because you're unhealthy. Unless you and your friends have the same book, then they might. Or you might get to laugh at them. Either way, it's cool because laughter is the best medicine. See, you're already on your first step to healing. Seriously, though, knowledge is half the battle. The other half, more like 7/9, is putting in the work. Once you have the knowledge, you got to start somewhere. Start with this quiz. 1, do you eat fried foods? And then they give you different options. A is less than twice a week. B is occasionally, but I'm mindful of it. C, pretty regularly. D, if it ain't fried, I probably won't do it. 2, how long would it take you to walk a mile? A, less than 10 minutes. B, between 10 and 20 minutes. C, I'd have to take a few breaks, so I'm not sure. D, why would I walk a mile? 3, when seated with my legs when seated with my legs straight in front, I can bend forward at the waist and reach. A, past my toes. B, near my shoes. C, my shins. D, my knees. 4, I can balance on one foot, extend my arms, and stand still. A, more than 3 minutes. B, 1 or 2 minutes. C, about 30 seconds. D, I'm not even going to try that, embarrass myself. 5, do you drink sugary sodas and artificially flavored juices? A, never. It's real fruit juice, tea, and water for me. B, rarely. I go for days without having any sugary drinks. C, sometimes, but I can manage a day without any. D, often. It would be hard for me to go without them. 6, do you exercise? A, I could be an athlete or personal trainer, 30 to 60 minutes most days. B, I'm in decent shape, but I'm not ready for the marathon, about 30 to 45 minutes a few times per week. C, I can help move you out of your apartment, but not by myself, about 30 minutes twice a week. D, sometimes I have to walk across a big parking lot, very little, if ever. 7, do you eat sweets or candy? A, what's a snickerdoodle? Never. B, where's the snickerdoodles? Rarely. C, I need some snickerdoodles sometimes. D, I am the snickerdoodle. Often. Do you eat red meat? A, never. B, not often. C, at least once or twice a week. Or I eat beef but not pork. D, they call me Swinfield. 9, do you have breakfast in the morning? I'm not a big breakfast person. I like my smoothies and teas. And I'll break fast with some fruit, maybe close to the 12. But 9, do you have breakfast in the morning? A, yes, daily, and it's usually pretty healthy. B, most days, and it's usually pretty healthy. C, most days, but it's usually not that healthy. D, does a cup of coffee count? 10, do you smoke? A, no, and I never have. B, I used to smoke, but I quit. C, I don't smoke, but I live with or work around smokers who puff near me. D, all day. Nicorette ain't got a patch strong enough for me. 11. When was the last time you had your blood pressure and cholesterol checked? A, within the past year. B, within the past 2 years. C, several years ago. D, I can't remember. 12. How much sleep do you get at night? A, 6 or 7 hours a night. B, 8 or more hours a night. C, less than 6 hours a night. D, my sleep patterns are so irregular I couldn't even tell you. 13. Do you use any recreational drugs? A, nope, I get high off my success. B, I might smoke a little weed on occasion, but that's it. C, I might do a little bit more than weed. D, I would be considered a junkie if you were trying to be mean. 14. How is your dental health? A, my dentist worships me. B, I haven't seen a dentist in a while, but I brush and floss regularly, and I don't have cavities. C, I don't brush or floss like I should, and I probably have a few cavities I need to address. D, I'm probably going to lose some of these teeth. I love the way these questions are, the way he got you answering. 15. How much sunlight do you get? A, if I was white, I'd have an awesome tan. B, I get at least an hour of sunlight daily. C, I'm stuck indoors most weekdays, but I try to make up for it by getting some sun on the weekends. D, I'm practically a vampire. I can't remember the last time I spent a while in the sun. 16. How much water do you drink? A, all I drink is water, more than 64 ounces. B, 8 glasses a day like the doctor says. C, I don't drink as much as I should, 16 to 48 ounces. D, there are too many other things that taste better, 0 to 16 ounces. 17, how do you deal with any illnesses? A, I know how to cure most things naturally and who to see when I don't. B, I consult with a healthcare professional and develop a regimen that will combat the illness. C, I see a doctor and hope they know how to fix me. D, I pop some pills, say a prayer, and hope for the best. 18, what kind of medicines do you take? A, mostly herbs, minerals, and whatever else Mother Nature provides. B, mostly natural stuff, but I use the synthetic stuff too. C, mostly the synthetic chemical stuff, but I've been trying natural remedies too. D, mostly pills, needles, and whatever else Medicaid provides. 19, do you have mood swings or rapid emotional changes? A, no way, that's crazy as hell. B, is rare, but it happens. C, more than I like to admit. D, all day, I'm crazy as hell. 20, when is the last time you fasted or did a cleanse? A, within the past month. B, within the past 6 months. C, within the past year. D, the only tox I know about is the one you do for a urine test. 21, how often do you get headaches? A, rarely. B, sometimes, but I usually know what caused it. C, often, and they can get bad. D, I got one right now, and I probably have another one soon. 22, how often do you eat fresh or steamed veggies? A, at every meal. B, at most meals. C, not often. Does rice and peas count? D, do the tomatoes and ketchup count? 23, when was the last time you had your stuff inspected? Pap smear, STD test, breast exam, testicular exam, prostate exam. A, within the past 2 years. B, 3 to 4 years ago. C, 5 or more years ago. D, I ain't done none of that nasty stuff. 24, how often do you treat pains with an over-the-counter pain reliever? A, I take one once or twice a year, or I use a natural remedy. B, I use them occasionally. C, I pop a pain reliever most days. D, over-the-counter, please give me that Vicodin, baby. 25, how much alcohol do you drink? A, I average 1 drink or fewer per day. B, I drink once in a while, but then I often have 4 or more. C, I have about 2 drinks daily. D, I average more than 2 drinks a day. At times I can't remember how much I drank or what I did afterward. 26, what do you eat more of, pastries or fruit? A, all fruit, no pastries or sweets. B, more fruit than pastries and sweets. C, more pastries than fruit. D, mostly pastries and sweets, almost no fruit. 27, what's your waist size? Less than my hips. B, about the same as my hips. C, a little more than my hips. D, come on, son, I'm fat. 28, do you have a family history of heart disease, diabetes, cancer, or other hereditary illnesses? A, no parents or grandparents with any problems like that. B, 1 or 2 of my parents or grandparents have 1 or 2 problems like that. C, most of us got something. D, everybody's got something, and some of us got everything, or I have no idea. 29, which best describes your sexual practices? And then it doesn't list any options like all the rest of them. 30, I'm in a long-term mutually monogamous relationship. A, I'm not committed to one person, but I always use condoms when I have sex. B, I'm not committed to one person, and I don't always use a condom. C, I get it in by any means necessary. And there was no D option. I think that might have been a typo. I feel like that might have. I feel like where it had 30, it was supposed to be the answers to the which best describes your sexual practices. Okay. So where it says 30, I'm in a long-term mutually monogamous relationship. I think that was A. B was supposed to be I'm not committed to one person, but I always use condoms when I have sex. B should have probably been C. I'm not committed to one person. I don't always use a condom. And then C should have been D. I get it in by any means necessary. 31. How do you typically cope with stress? A, I regularly carve out time to recharge. B, I vent about my crises to a friend or family member. C, I don't know what to do. Usually I just feel overwhelmed. D, I depend on alcohol, food, or another vice to help me make it through the day. 32. I experience fatigue. A, only after a strenuous workout or similar physical activity. B, usually after a long day of work. C, after climbing a set of stairs, taking a long walk, or carrying something heavy. D, pretty much throughout the day, even though I haven't done anything. 33, I experience back or muscle pain. A, never. B, sometimes. C, pretty often. D, I stay with some kind of pain. 34, when I stand up against a wall. A, the back of my head, hips, and feet and shoulder blades touch the wall. B, only the back of my hips, feet, and shoulder blades touches the wall. I have to change my posture from my head to touch the wall. C, only the back of my hips and feet touch the wall. I have to change my posture from my shoulder blades to touch the wall. D, only the back of my hips touches the wall. I don't want to talk about it. So then it has a scoring chart based on if you answered all those questions and scoring ranges and explanations. So if you got 0 to 10, and again, this is asking like how are you healthy, and it's a pop quiz. So I give you all these questions, all these options, and if you were keeping track, you fall into one of these categories. So I'm gonna read them and then move on. So 0 to 10 is optimum. You're either insanely healthy or just plain insane. Most people are nowhere near this level of optimum health, so we congratulate you if you're telling the truth. If you lied, you may need to skip ahead and go straight to the section on psychological health, because that's just strange. Assuming that you were being truthful, you're a living example of the principles in this book. Because of how much information we've packed into the following pages, we're sure you'll still learn a lot, but you'll find this text most valuable if you use it as a teaching tool for the people you know who need it more than you. So if you got anywhere between 11 and 25, you have excellent health. It's a great score. You should be proud. You eat healthy, live healthy, and probably even think healthy. Sure, there are some things that you could work on, but with this book, you're definitely on the right track to optimal health and a long, satisfying life. It's in the caption, love, but this is called the Hood Health Handbook. I read it about a month ago, late night, and it's on my YouTube channel, so I'll be downloading this from Facebook and putting it on my YouTube channel, which is simply my name, Morgan Myers, with my red logo and the yellow M inside. So y'all stay tuned. I have a number of playlists of book readings over there, so go enjoy yourselves. We got 26 to 50, which is decent. Even with the score in this range, you're still doing better than most Americans. But if you think about it, that's not necessarily a high standard to measure yourself against. Perhaps you need to eat more fruits and vegetables and less junk. Perhaps you should be exercising more and spend less time indoors. Perhaps you should go to see a doctor or a dentist soon. Whatever the case, you have plenty of room for improvement, and this book will make sure you cover it all. 51 to 75, you're unhealthy. Don't be offended at being called unhealthy. We're just being real with you. You knew you weren't too healthy when you took this quiz, so don't be mad at us for telling you what you already know. The question now is, what am I going to do about it? You can either continue on the downward spiral of unhealthy living, cut several years off your life, and finally end up dead before your time, or sick and miserable in your old age, or you can get on the upward spiral to better living. It's your choice. You have family members who chose not to address their health until it was too late. You've seen what happens. It's going to be some work, but this book will guide you through many of those changes, showing you both the big steps and the baby steps you can take. Aren't you tired of feeling the way you do? Make a decision. Your bad habits can still be changed. If you got 76 through 90 score, you're sick. You've got a lot of unhealthy habits. You know you do. You've been treating your body like a rental car, and you don't plan on returning. But it's all going to get billed to you in the end. You pay for all those habits one day, some way, and it's never pretty. In your present condition, you're probably already sick. You may have diabetes, cancer, arthritis, heart disease, who knows? You may not even know what you have, but unless you're going to kill yourself now, you should consider this. 91 to 100 is dead. Seriously, how do you even get a score in this range? I know crackheads who would score higher. Either you were trying to be funny when you took this quiz, or you're an unhealthy crackhead. You can't even get 100 points on this quiz. It's mathematically impossible. Just like it's almost physically impossible to live much longer with the type of lifestyle you have. If you scored in this range, if you really scored between 91 and 99, this book could literally save your life. The first step is knowing you can improve. Then you apply the solutions. So, you know you're unhealthy when your breath smells like shit, you can't take a shit, your hair's coming out and you ain't 70, you get thirsty at work or school and drink a Mountain Dew and it's 9:30 a.m., you can't run a single mile even if someone's chasing you, you always feel tired even when you wake up, you're seriously overweight, you're seriously underweight, Kool-Aid is your idea of a fruit juice. You are a vegetarian, yet you never eat vegetables, just carbs and proteins. This is how you know you're unhealthy when you start discussing the fact that KFC should do delivery. You're breathing hard and sweating after only climbing a few flights of stairs. You have a hard time breathing and you haven't done anything yet. You'd rather eat fast food because it tastes better than live foods. You don't even know what live foods are. You're addicted to junk food and don't know it. You think Miller Lite is healthy because it's light. You have acne and you're an adult. You think sugar-free or low-carb means healthy. You sleep all day. You're addicted to something white, cocaine, heroin, Xanax, sugar. You can't sleep at all. Your parents are brown, but your skin is pale. You think pork is the other white meat. Your mind is more toxic than your body. This is a list of you're unhealthy when. We're reading out of the Hood Health Handbook, and they are not, they're not playing with us, okay? They're giving it to us real raw and authentic, and I love it. Your mind, you're unhealthy when your mind is more toxic than your body. Your family has tried to do an intervention with you and it didn't work. Your family has tried to put you on one of those weight loss reality TV shows. You're an emotional wreck. Peace. As you can see, I am just reading. I don't do like tarot readings. I read books. So welcome and enjoy. Your family has tried to put you on one of those weight loss TV reality shows. You're an emotional wreck. You know you're unhealthy when shit comes out of your body that makes you say, what the Your feet stink even when you ain't been running. You make your eating decisions based off of TV commercials. You get sick, know why you are sick, and still do what makes you sick. You can't sleep without smoking a blunt. Uh-oh. You live to eat instead of eating to live. You step over the backs of the people in front of you to get off the bus and take a smoke. You see vegetable fried rice. Take the things you don't like out and you just have rice. You're not interested in sex. You always have headaches. Your annual checkup makes you a nervous wreck for weeks before your appointment. Your urine is not clear enough to damn near see through. Your urine smells like stale movie theater popcorn. You know you're unhealthy when you can't do 20 push-ups without a struggle. This goes for females too. Uh-oh. I pump out a good 10. I have to take a little break to get to that 20. Your private parts smell like public sanitation. You put just about anything in or on your body. Habits reflect just how healthy or unhealthy one is. Reevaluate how you live to improve your health. The lies we tell ourselves by Supreme Understanding. Basic useful lies we love to spit to help ignore the truth, also known as bullshit. That was an acronym for bullshit. Basic useful lies we love to spit to help ignore the truth. We tell ourselves a lot of lies to avoid change. We, meaning damn near all of us. It's a psychological principle called cognitive dissonance, which means that people normally respond to uncomfortable challenges by telling themselves the evidence is bullshit. In reality, we're the ones BSing, and most of the time we know it, but we keep self-medicating with them lies so we don't have to feel bad about not changing. But you already know what happens to people who can't change. Another principle called survival of the fittest takes effect, and whatever can't change dies. Let's examine some of the lies we tell ourselves about becoming healthy. I already am healthy. If you're like most of us, you're probably not. America is the sickest country in the world. It's a documented fact. And black and brown people are its sickest citizens. We're the fattest, the most diseased, the most toxic, the most psychologically ill, basically everything. Even those of us who aren't totally screwed are still residually affected somehow. So we all have some growing to do. Why do you feel like you're the only one who has no room to improve? And isn't that a sign of being sick? This is my cultural heritage. And then in the footnote, they have a number 5 beside this. And so when you see that, you refer to the bottom of the page to see what it reads. And so, I'm on page 33. And it says, this refers to an unhealthy habit, from eating pork to smoking crack to drinking liquor when depressed. That, on the other hand, refers to any healthy habit or lifestyle change. So it said, this is my cultural heritage. No, it's really not. These are the unnatural diets and lifestyles we developed living in an unnatural environment. Africans didn't eat most of the things we call black food before slavery, and we really didn't even eat it during slavery. See the history of soul food later in this book. You gotta die of something. Might as well do this and enjoy it. In that case, everyone should smoke crack cocaine. Crack's gotta be a more exciting rush for the senses than a pork chop, right? So why not? Because we calculate our risk against the benefits we receive. So once you get past the taste, which is mostly chemicals and seasonings anyway, and realize there are almost no health benefits to the crap we're defending, why are we still doing it? Easy. It's addictive, just like crack. Don't believe me? Do what KRS-One said and prove it ain't addictive by giving it up for a month. Watch the withdrawal symptoms you go through. If you're thinking a little bit won't hurt me, again, you wouldn't say that about smoking crack or licking poop. A little bit is the only true gateway drug. See, junk food is crack. My grandpa is 150 years old. So these are the lies we tell ourselves section. My grandpa is 150 years old. Or more specifically, my grandpa does the same bullshit every day, and he's 150 years old. These kind of stories are fun to listen to, but everybody knows you don't base your lifestyle with this, off the exception to the rule. Let's face it, out of the 100 people with the same habits, only one lived this long. The rest of them died between 48 and 70. Beyond that, I've met some of these magical elders people talk about. Sure, they're alive, but they're in a wheelchair, missing a foot, and breathing with the help of an oxygen tank. I don't want to end up like that. The healthy ones are much rarer, but usually those are the ones who had a few unhealthy habits, but also worked 16 hours a day of physical labor, never cheated on their wife, but only drank on Saturdays, meaning their healthy habits outweigh the unhealthy. But how many pork eating, beer chugging, sleeping around, never exercising, barely bathing males or females do you know? See Elder Wisdom. This was bad for you back in the day, but they fixed it. No, you mean they made it worse. Sure, they reduced the number of live parasites in a slab of beef from 300 to 250, but in the meanwhile, they also added 200 more chemicals, hormones, pesticides, and antibiotics. Same goes for damn near any other unhealthy habit we think science has improved. The lies we tell ourselves. I'm already on a diet. That's why this book isn't about dieting. It's about living. Living healthier is a holistic process, which means whole, not just what you eat or how much you eat, but many other things as well. You'll actually die from some of these stupid diets. The second thing is process, which means it won't be over in 30 days. It's going to continue for as long as you want to live. The lies we tell ourselves. I have medical coverage. Despite all the evidence, people still believe that doctors and medicines can fix just about anything. But there are several problems with this pipe dream. First, if you're black or brown, you're going to get the worst treatment. That's well documented. Second, if you're poor, you're really going to get worse treatment or no treatment. Third, even if you do get treatment, it's not going to fix you. Western medicine doesn't cure. It covers up. You get halfway patched up or doped up to the point you don't feel yourself, still dying. Seeing are all doctors mad scientists. My cousin did that, and she's still unhealthy. Okay, so let's go back to the footnote. When it said, this is my cultural heritage, this refers to an unhealthy habit from eating pork to smoking crack to drinking liquor when depressed. That, on the other hand, refers to any healthy habit or lifestyle change. Okay, so say my cousin did that healthy eating stuff and she's still unhealthy. Again, this is an example of people using one person's experience as all proof they need. Chances are that she did something that sounded healthy but really wasn't. B did something healthy but only halfway, or C did something but not the thing she needed to do most to become healthy. There are literally thousands of studies involving hundreds of thousands of people which show that the recommendations we make in this book work. They even work for your cousin. The lies we tell ourselves, it's too late for me to change. Totally untrue. Elderly people who have changed their lifestyles have been able to do everything from improving their memory to reversing their diabetes. And we're talking about people age 70 plus. So what's your excuse? That healthy stuff is too expensive, hard, weird, and nasty. That stuff won't be half expensive or as those medical bills or funeral bills or as difficult as the death of a loved one. We're not telling you to eat garlic curried spinach leaves or rock Jesus sandals and quartz crystals. What's weird about being that person everyone turns to for nutritional advice? What's the point? Everything is bad for you. Every time I talk about the chemicals and everything, from our tap water to our air supply, people start using this as an excuse to keep their unhealthy habits. That's like me telling a woman that all men have some sort of issues. We do. So she uses that as an excuse to keep dating Bobby Brown. That's dumb. The smart thing to do is eliminate the worst things from your life first and slowly work on the others. That way you minimize your risk instead of maximizing it. But when people start talking all illogical like that, I already know it's the addiction speaking for them. And I've been addicted before, so I understand. Don't fool yourself. Build an argument for what is healthy instead. I love that. So he just broke down all these lies we tell ourselves, because that really be what it be. We know what we gotta do. We know when we acting out. We know when we not putting the right things in our body. We know we ain't bought the live alkaline water from Morgan yet. Got it shipped to them even though you don't live in North Carolina. We know. We just gotta do better. We gotta stop making excuses and lying to ourselves, or else we're gonna pay for it one way or another. Don't fool yourself. Build an argument for what is healthy instead. What is good health? By Supreme Understanding. Your body's engine is in good running shape, meaning your heart works. This means if you don't have a weak heart, high blood pressure, low blood pressure, heart disease, heart attack, strokes, or any of the other conditions related to your circulatory system, your body can produce the substances it needs to function. Excuse me. These substances include insulin, antibodies, serotonin, white blood cells, vitamin D, and thousands of other essential chemicals you need to function properly. Excuse me. This is a list of what is good health. Your body is not in physical self-destruct mode. Self-destruct mode can mean any number of autoimmune conditions, from Crohn's disease to cancer, where your cells are basically attacking each other. You're able to produce healthy offspring. This means you can make children or bear children without complications such as impotence, infertility, miscarriage, and other reproductive issues. Your body can eliminate toxins and waste. This means your liver, kidney, spleen, stomach, intestines, colon, and pores, yes, the pores in your skin, work like they're supposed to. You can escape a burning building and save others. This means you're in good enough physical shape to climb down a fire escape, jump out a window, crawl through a smoke-filled hallway, and or save people who are passed out. Your body can defend and repair itself. This means your immune system works and you heal naturally at a normal pace. You're not in mental/emotional self-destruct mode. This means you're in a state of good psychological and emotional health, and you're actually satisfied with living your life, not destroying it. You can breathe without a problem. This means your lungs work. Your respiratory health can be affected by asthma, bronchitis, pneumonia, and dozens of other conditions. You don't look like crap. This means you don't have problems affecting your skin, hair, nails, eyes, posture, weight, or other physical features that are caused by poor health. Maintain all your bodily and mental functions. They decide the quality of your health. What your body is telling you. Signs and symptoms not to ignore, by Supreme Understanding and Shy Honor Devotion. And it has a quote. A man too busy to take care of his health is like a mechanic too busy to take care of his tools. That's a Spanish proverb. We regularly put up with many symptoms of early disease, and men do so for far longer than women for obvious warnings, like a terrible fever that signals infection, to more subtle clues like losing hair on your toes, which can be an early sign of vascular disease. Now, some signs that might scare the hell out of you may actually be harmless, but some things that seem minor can warn of a of a serious disorder. Still, others can be unclear. Does that growing gut mean you're just letting yourself go, or is it a sign of ovarian cancer? Only a professional can tell. But the problem is that most of us don't notice anything, even when the warning light is flashing and beeping at us to stop. For example, Miami rapper Trick Daddy just thought he had a bad case of dry skin until he got tested for lupus. See, what is lupus? T-Boz or TLC just thought her painful headaches were another symptom of her sickle cell disease until an MRI showed that she had a brain tumor. And Ghostface Killer thought he had the symptoms of a common STD until he found out he had diabetes. All of these conditions are life-threatening, so why stay in the dark about what's going on in your body, especially if it's trying its best to tell you what you need to know? Let's take the top to bottom approach and analyze your body's check engine lights. We also break down a lot of the following conditions more specifically later. So hair. Your hair may be dry and brittle because it's over perm, you're applying too much heat, or just straight up over processed. Dry hair may also mean an underactive thyroid or nutritional deficiency. Thinning hair and baldness doesn't affect just the fellas. Female pattern baldness often runs in families and can also be associated with aging, menopause, an overactive thyroid, or an early warning sign of diabetes. Thinning hair can also be from overprocessing. Metabolic and circulatory disorders can cause a loss of body hair. Nails. Ladies, make sure that your nail shop is up to code and uses sterile equipment. Otherwise, you may be paying top dollar for a fungal infection with your mani and pedi. Besides being overprocessed, thyroid disease can also cause your nails to become dry and brittle. Splinter hemorrhages are dark, horizontal side-to-side streaks under your fingernails or toenails. This can be a sign of trichinosis, meaning you're infested with parasites because you've been eating undercooked pork or wild game. However, splinter hemorrhages are also warning signs for psoriasis, peptic ulcers, kidney disease, lupus, rheumatoid arthritis, blood clotting diseases, or endocarditis, an inflammation of the heart tissue. So a splinter hemorrhage are dark, horizontal, side-to-side streaks under your fingernails or toenails. Oh, yeah, I don't have those, but I think I know what they're talking about. Booze lines are horizontal, side to side, and sometimes appear when your body experiences a period of significant stress or illness. Your body is busy struggling to handle other priorities, so your nails take a little break and then start growing again. If the skin underneath the nail bed, is white, this may mean you're anemic. Nails that are white near the cuticle and red or brown near the tip can signal of kidney disease. Irregularly shaped brown or blue spots in the nail bed can be melanomas. Fingertips that are blue or clubbed are a sign of chronic lung disease. Skin, rashes, or breakouts can be caused by allergies to various foods or detergents. That innocent spot on your skin that you thought was just a mole or a scar may turn out to be a sign of cancer. You can tell by using the ABCD self-evaluation method. It may be malignant, cancer-causing if it has an asymmetrical shape, a jagged or irregular border, a suspicious color, a diameter larger than a pencil eraser, and is elevated and uneven. Basal and squamous cell carcinomas tend to be red to pink, are crusty, and bleed easily. If you have more than 50 moles on your body, you're at increased risk for melanoma, a deadly form of skin cancer. Lesions or ulcers on the skin that will not heal are associated with diabetes. Diabetics have poor circulation and as a result heal very slowly when they suffer a skin injury. Large patches of dark skin on the neck and underarms are also indicators for diabetes. Oh, wow. Persistent headaches. Headache that lasts for more than 2 or 3 days are a cause for concern. If accompanied by vomiting or vision changes, it could mean something is wrong in the tissues surrounding the brain, like a clot or a tumor. Headaches are also one of the first signs of dehydration, especially if you're suffering from a hangover. So drink lots of water or fluid with electrolytes in it like Gatorade or Pedialyte. Okay. Eyes. See floaters. Those spots or flecks that float across your field of vision is pretty common, but a sudden increase in floaters may mean that you have a retinal tear or even a retinal detachment, especially if flashing lights accompany the floaters. This requires immediate medical attention. Your eyes may feel dry all the time because of low humidity where you live. This can also be caused by drug side effects. If your eyes are dry all the time chronically, this may also be a warning sign that you have an autoimmune disease like rheumatoid arthritis, hyperthyroidism, or lupus. If your eyebrows no longer extend over the corners of your eyes, this may be an indication that you have an underactive thyroid. Dark circles around the eyes can mean that you have allergies, anemia, that your liver is overworked, or that you're just plain tired. Small yellow bumps on the eyelid may be fat deposits that signal high cholesterol. High cholesterol raises your risk for heart disease. Little bumps that look like cobblestones on the inside of your lower eyelid mean that they're probably allergic to something. The eye's motor movement responses can be used to diagnose many medical conditions such as diabetes and schizophrenia. Ears. It's normal to hear your heart beating, especially when you're lying down. But if you can only hear your heartbeat in one ear, this may be a warning sign for a heart murmur, high blood pressure, or other vascular disorders. If normal noises seem louder than usual, you may be drinking too many diet sodas that contain aspartame. Supersensitivity to sound may also be caused by magnesium deficiency or an autoimmune disease. A diagonal crease in the earlobe may signal a greater risk for heart attack, but this isn't true for Native Americans and some other ethnic groups. Nose. Your sense of smell can be affected by any number of things. Cigarette smokers can't smell or taste as well as non-smokers. As you get older, your sense of smell also tends to fall off a little. Injuries to your nose, nasal polyps, or deviated septum may also impact smell. Interestingly, zinc deficiencies, hypothyroidism, and underactive thyroid, diabetes, multiple sclerosis, Parkinson's, and Alzheimer's disease may also impact your sense of smell. An inflamed, red, and bulbous round nose is often a sign you've been hitting the alcohol long and hard. This type of nose may also be caused by rosacea, which triggers or worsens the skin condition. Breathing through the mouth may mean allergies, congestion, or you may be under serious stress. We're supposed to breathe through our noses because that stimulates our vagus nerve, slowing down our heart rate, relaxing our blood vessels, and reducing stress. Mouth. Suffer from yuck mouth. If you've got a terrible taste in your mouth that won't wash away with mouthwash, this may be a side effect of a medication or vitamin supplement you're taking. But this may also be a sign of gum disease and cavities. Viral infections, gastrointestinal, stomach disorders, Bell's palsy, facial paralysis, and burning mouth syndrome, a rare condition primarily affecting menopausal women, may also cause yuck mouth. Although gingivitis can cause your gums to become inflamed and bleed, diabetes and leukemia can also play a role. If your lips are cracked lips, you may have a vitamin deficiency. Missing teeth or mad gaps in your grill can be a sign of poor nutrition, advanced gum disease, or long-term drug use. Chronic bulimia leaves telltale acid marks on the inside of the teeth. Say ah. A healthy tongue is covered in tiny bumps, papillae. If your tongue looks or feels very smooth and glassy, you may have a nutrient deficiency. It's time to take some folic acid, vitamin B12, or iron. A smooth red tongue may indicate pernicious anemia or possibly malabsorption syndrome. Your body can't absorb the necessary nutrients. You may also be breathing through your mouth because you're too fat, and breathing through your nose isn't allowing you to move enough oxygen since you've got all that weight on your chest. Breasts. Now's your opportunity to cop a feel. Seriously, lumps beneath the arm and in the breast, as well as dimples, swelling, and discharge, may signify breast cancer, and not just in females. Fellas, you can develop breast cancer too, with many of the same symptoms. Always seek medical attention if you find a lump. A condition which causes men to develop enlarged breasts is Gynecomastia. This may be caused by an imbalance of estrogen, female hormones, and testosterone, male hormones. With all the hormones that dairy cows are fed to increase their milk supply, you may be drinking female hormones without realizing it. Gynecomastia also occurs during puberty or with aging and can also be a sign of kidney disease or pituitary tumors. Stomach and digestion. A high body mass index or waistline measurement is a red flag to clinicians. But sudden unexplained weight loss can be even worse, suggesting serious depression, a gastrointestinal illness, a malabsorption syndrome, or even diabetes. If your stomach is rumbling a lot, this may only be because you're gassy from a diet that's too high in fiber, carbohydrates, or artificial sweeteners. Or maybe you're drinking too many carbonated drinks. Where do you think all those bubbles go? Excess gas may also mean that you're lactose intolerant, can't digest milk products, or that you have other food or drug allergies. If your stomach is constantly aching, don't ignore it. You could be suffering from ulcers, a gallbladder condition, or pancreatic appendix, or digestive issues. There's also a condition which usually occurs in children called abnormal migraine. This is similar to when adults get migraine headaches. If you haven't had a bowel movement, pooped, taken the Browns to the Super Bowl, or shat for 3 days, you are what we call backed up. We're supposed to be eliminating each time that we eat, but some of our bodies are so jacked up that we're happy to go once a day. Some of us even settle for once every other day. Drink lots of water and eat lots of fruits and vegetables to keep it moving. And if you've ever wondered why your kids are dropping bigger turds than you, think about all the nasty stuff they're accumulating in your system. Think about all the nasty stuff that's accumulating in your system. Better out than in, right? If your stools are often small or thin, you may have a gang of blockage down there, which can be a warning sign for colon cancer or its precursor, colon polyps. If you're eating smaller portions than usual but feel full and you are often nauseous, vomiting, bleeding, and experience fever or weight loss, you may have a bowel obstruction. This means that something is preventing you from pooping. Surprisingly, vomiting can sometimes be caused by stress. If you've had diarrhea for 2 to 3 days, you may have a bacterial or viral infection, parasites, or a colon problem like cancer. Don't be afraid to look in the toilet after you go. The color of your stool can tell you a lot. Black, tar-like stools may be a result of taking too much iron, but can also be caused by bleeding in the stomach or the esophagus. Bright red stools may be caused by intestinal bleeding, but more often coming from eating red foods, especially if they're artificially dyed. If your stool is very pale, this can be a result of too much calcium, or it may come from eating a lot of rice or potatoes. But if your stool is always pale, this may be a signal that your bile ducts are blocked by tumors, a pancreatic disorder, or liver disease like hepatitis, cirrhosis, or liver cancer. Stool with an extremely bad and unusual smell can indicate a more serious condition such as cystic fibrosis, Crohn's disease, ulcerative colitis, or chronic pancreatitis. So what I'm getting, all of this is a lot, but what I'm getting is that we got to be mindful and conscious of what our body's going through and not ignoring it. Because sometimes, we'll wake up, we'll be going through things, we'll just deal with it because we just feel like that's what it is. But we really got to be mindful of what we're doing so we can know how to better assist taking care of ourselves. Because if we're not aware, we're just going with the flow. We just, I don't poop. No, you need to be mindful of what you got going on. Urinary tract. The first time that you urinate in the morning, expect that your urine will be darker and smellier than it will be for the rest of the day. This is because, as you sleep, the minerals and toxins in the body accumulate. For the rest of the day, your urine should be light colored and odorless. This is assuming that you have a normal functioning kidneys, no bladder disease, and no infection. What you eat can also affect the odor and color of your urine. Asparagus causes your urine to smell strange, and turmeric, a spice, can turn your urine bright yellow. Sweet-smelling urine is caused by the excretion of blood sugars and can be a warning sign for diabetes. This sweet smell is associated with ketonuria and may also occur as a result of excessive dieting. Red urine can indicate diabetic nephropathy. diabetic-related kidney failure, papillary renal cell carcinoma, cancer, aloe poisoning, or simply eating too many beets or using certain prescription drugs. Frequent urination is also associated with diabetes. Blood and urine can be a sign of a urinary tract infection or bladder cancer. Blood in the urine may also occur due to cysts, stones, infection, or inflammation along the urinary tract. Very low urine output, known as oliguria, can be a symptom of renal failure, urinary blockage, or insufficient blood supply to the kidneys. Men with enlarged prostates or prostate cancer have difficulty with starting to urinate. Women who have difficulty controlling their bladder can practice Kegel exercises to strengthen their muscles and prevent leakage. A loss of bladder control is sometimes a result of multiple childbirths. If you feel the need to urinate, but only a few drops trickle out and it hurts like hell, you could have a urinary tract infection, or you may be burning from an STD. Better get that checked out, homie. Menstrual cycle. Normal menstrual cycles, if you have them, are timed anywhere from 21 to 35 days apart. More frequent, and they could indicate a gynecological condition like fibroids, benign uterine tumors, or endometriosis, a condition where the tissue that lines the uterus starts to migrate outside of it. Sometimes a woman has a really painful cycle and has no idea she's suffering from endometriosis. The endometrial tissue, which usually lines the uterus, attaches to other body parts and organs like the ovaries and bowels. If your menstrual cycles are erratic, you could have polycystic ovary syndrome, or PCOS, a hormonal imbalance caused by an overproduction of male hormones, a condition thought to affect up to 10% of all American women. Abnormal bleeding can also be a sign of miscarriage, disease, or pregnancy, and should also not be ignored. Some women in their 30s also start to notice heavier or more frequent bleeding caused by hormonal changes. Either way, if you notice something out of the ordinary, it's a good idea to get checked out, and if you're a man, you definitely need to see someone. While we're down here, the reproductive area. Itching, burning, bumps, lumps, little bugs, sores, blisters, discharge, or anything else that's unusual around your genitals could be signs of sexually transmitted diseases, STDs. Painful urination, pelvic pains, and pain in the scrotum are signs of an STD. Go get checked out on the regular so that you're not the one who is infecting and reinfecting others. That is so not a good look. Most STDs are treatable and curable. Legs. Swollen legs and feet are an indication that your body is not eliminating water properly. This is also called edema. Edema can be a sign of kidney or liver disease or even heart failure. Congestive heart failure not only affects the lower extremities, it may also cause for your lungs to fill with fluid. This is called pulmonary edema. Pregnant women are also frequently infected by edema, but don't worry, sis. It's an excellent excuse to sit down and put your feet up. Feet. Numbness and tingling in the feet can be indicators of vascular disease and other circulatory problems. Nerve damage also often begins at the extremities, hands and feet. Numbness and tingling often occur as a result of nerve damage, and this condition is associated with uncontrolled diabetes. Since blood circulation is comprised for diabetics, even a minor scratch or sore on the feet can become easily infected easily. The lack of sensation can make it easy to ignore the wound. Gangrene can then set in, requiring amputation of the affected limb. People with diabetes are urged to check their feet every day for any kind of scratch or lesion. If you have pain, tenderness, or limited motion in the joints of your feet, you may have arthritis. This is specifically true if this pain worsens over time. If you are a male and over 30 with acute pain in the big toe or other joint, you may have gout. Gout results in hot, red, and swollen joints. The gout is caused by high levels of uric acid in the blood and is a chronic form of arthritis. If you have flat feet, you're at increased risk of exercise injuries. If your feet lose color and you notice increased or periodic swelling in the lower extremities, you may have hypertension. Pain in your ankles can be a sign of problems in your knee and hip joints. Symptoms of all kinds are your body's way of communicating with you. Defined as a change for normal function or appearance, minor or serious, symptoms are warning signs. A diseased person can typically experience indicators over a long period of time before a diagnosis is made. As Peter McWilliams writes in Life 101, pain, any pain, emotional, physical, mental, has a message. The information it has about our life can be remarkably specific, but it usually falls into one of two categories. We will be more alive if we did more of this, and life will be more lovely if we did less of that. Once we get the pain's message and follow its advice, the pain goes away. The more severe the pain or illness, the more severe will be the necessary changes. These may involve breaking bad habits or acquiring some new and better ones. I'm trying to find a good stopping point. Okay, let me keep going. If we pay attention to these indicators early on, we might prevent the onset of disease altogether. More signs and symptoms not to ignore by Sayana Devotion. Chest pain. Although chest pain may be caused by something as simple as heartburn or indigestion, it can also be a warning sign for something much more serious. Your heart may not be getting enough blood. When your heart muscle doesn't receive enough blood, you'll experience an acute myocardial infarction, sudden heart muscle death, or what we laymen like to call a heart attack. Other symptoms of AMI are pain in the chest, pain in the jaw, or pain in the left arm. Difficulty breathing and profuse sweating are also associated with AMI. We shouldn't have to tell you to call 911. Shortness of breath. Shortness of breath can be caused by many factors because of the conditions that original people live in: smog-filled cities, mold-filled housing, frequent exposure to tobacco smoke. We suffer from asthma, sometimes called reactive airway disease or RAD, at higher rates than the general population. Albuterol inhalers are prescribed as rescue inhalers for asthmatics. It's necessary to find out what your triggers are, what causes your asthma to act up. Triggers can be anything from pet dander to pollen to exercise. Shortness of breath may also be caused by an exacerbation, worsening of a chronic lung condition that tobacco smokers suffer from. This condition is called chronic obstructive pulmonary disease, and there is no cure for it. Uh-oh. Do yourself a favor and stop smoking before COPD or lung cancer sets in. Shortness of breath may also be caused by pneumonia or pulmonary edema. Both of these conditions limit how big a breath you can take. Whatever the case, if you're short of breath, then find out why. The breath of life is important. Coughing. Coughing may also occur as an allergic reaction. Any inhaled irritants will cause you to cough. These irritants may be tobacco or marijuana smoke, dust, or smog. Unintended weight loss. This could be a sign of an overactive thyroid. Sometimes unintended weight loss is the first sign of cancer or liver disease. Surprisingly, depression may cause you to lose weight, as you may become less interested in eating. Coordination. If you're so weak and unbalanced you can't walk straight without falling or bumping into something, you may be experiencing muscle or brain problems which are affecting your coordination. Weakness and imbalance may also be signs of a stroke. Nowadays, people as young as in their early 20s are having strokes, so don't take this lightly. If you're having coordination issues, weakness, especially on the left side, a loss of vision, and slurred speech, put down this book and call 911. These are definitely stroke symptoms. Headaches and a loss of balance can be included. Pain on the right side of the body. This could be caused by gallstones. Gallstones are collections of calcium and cholesterol that accumulate in the gallbladder, which is a small sac beneath the liver. These stones can block the digestive tract, but don't worry. Dandelion leaves from right outside. Yes, the yellow flowers that we call weeds have medicinal properties. Their leaves can help dissolve these stones. Milk thistle, another weed, can help too. You'd be surprised what herbs you can find in the hood. Body temperature. A rectal temperature reading is said to be the most accurate, but it isn't always that serious. A fever is a rise in internal body temperature to temperatures considered to be above normal. Normal body temperature is considered to be about 98.6 Fahrenheit or 37 degrees Celsius. You are considered to have a fever when your body's temperature is above 100.4 degrees Fahrenheit and 38 degrees Celsius. If you take your temperature when you wake up, when your body temperature is at its coolest and it's below 98.6, this could indicate that you have a condition called hypothyroidism or an underactive thyroid. Did you know fevers are frequently a sign that your body is fighting off a bacterial infection? They also sometimes occur as a result of viral infection. Your body turns up the heat in an attempt to kill off the invaders. However, since viruses take over your cells, they are not necessarily recognized by the body. Although infection is the most common cause of fever, fever can also be caused by medications like antibiotics. This is called drug fever. Some other conditions that can cause fever are trauma, injury, heart attack, stroke, heat stroke, surgery, arthritis, cancer, lupus, and the gout. Fatigue. Fatigue may occur because you may not be getting enough quality deep sleep. You may be stressed out. You may have just finished exercising or doing other strenuous activities. You may be jet lagged, etc. Or you may be experiencing chronic or constant fatigue because you have an iron deficiency, because you're coming down with something, or your body is using its energy to fight off infection, or because you may be pregnant. Get your mind right. Many of us suffer from mental illnesses and often overlook it. Sudden changes in the mental state can appear in many different forms. Sudden confusion, erratic mood changes like being really drained to severely agitated, extreme aggression, disorientation, sudden memory problems, delirium. Like Buster said, this is serious and it's also very dangerous. The mind and body work closely together. If your body is fighting an infection, or if you have low blood sugar or are anemic, this can result in mental health issues. If you're normally interested in sex but you're not anymore, sad after your baby is born, or you're even considering hurting the baby or yourself, something ain't right. Are you exhausted even though you sleep all the time? Suicidal, worried, or always anxious? Do you hallucinate? Either seeing things that aren't real, visual hallucinations, or hearing the voices of people that aren't there, auditory hallucinations. Something ain't right. Emotional problems are often overlooked in our communities and aren't considered to be very serious. Well, they are serious. Get some help. If you know someone else who is experiencing these symptoms, please be a friend and get them some help. In the society we live in, it is easy to fall into a slump. People are hungry, worked to the bone, overwhelmed, sad, and just sick and tired of being sick and tired. Don't beat yourself up. You have every right to be down, but you can't allow yourself to stay down there. Make a move to pick yourself up. See, Get Your Mind Right in Volume 2. Most symptoms are curable with a change in lifestyle, but don't dismiss medical attention. Hear the warnings. And I am going to stop there. Is it all in your head? What is somatization is where we'll pick back up on the next reading. Thank y'all for being tuned in. Hope you learned something. And make sure you take care of yourselves. And make sure you hit me up to get your own bottle of live alkaline water locally sourced in North Carolina on indigenous land, black-owned lands. We got gallons, 20-ounce plastic, glass, and we ship, and we do subscriptions on 5 gallons. So appreciate y'all for tuning in, and I'll be back with you soon.